In 1980, the United States government published a set of dietary guidelines that would reach nearly every citizen. These weren't suggestions, they were official recommendations, printed in textbooks, hung in school cafeterias, and repeated by doctors during routine checkups. What made them unusual wasn't their existence, it was their scale. For the first time in modern history, an entire population was being told to eat in a specific way. Not because of famine, not because of war, but because experts believed they had identified the optimal human diet. The guidelines were simple: reduce fat, especially saturated fat, increase carbohydrates, eat more grains. Within a decade, this advice had restructured the food supply of the wealthiest nation on Earth. At the time, this was considered progress. The logic seemed reasonable. Heart disease rates had been climbing since the 1950s. Researchers noticed that people who ate more fat appeared to have higher cholesterol. Cholesterol was found in arterial plaques. The conclusion felt obvious. Fat causes heart disease. Remove the fat, and the problem should diminish. It was a clean hypothesis. It was also untested at the population level. But the guidelines were issued anyway. Most people didn't question it. The institutions they had been taught to trust. The American Heart Association endorsed it. The USDA printed it. Pediatricians handed out pamphlets. Within a few years, the recommendations had blended into everyday life. Low-fat labels appeared on yogurt containers. Skim milk replaced whole milk in school lunches. Margarine, made from vegetable oils, was positioned as the responsible choice. Butter, which humans had eaten for thousands of years, was now something to avoid. This wasn't discussed openly. There was no national referendum, no public debate about whether the science was strong enough to justify such sweeping changes. The guidelines simply became the standard. And once they became the standard, the food industry responded. If fat was the problem, then removing it would create an opportunity. Within a few years, grocery store shelves filled with products labeled low-fat and fat-free. But fat carries flavor. When it was removed, something had to replace it. In most cases, that something was sugar. Sometimes it was listed as sugar. Sometimes it was corn syrup, dextrose, maltodextrin, or fruit juice concentrate. The names varied, but the effect was the same. The new products were sweeter, more processed, and often higher in total calories than the foods they replaced. But they carried the label that mattered: low fat. Most people never noticed this at the time. They trusted that if a product met the guidelines, it was helping them. If the box said heart healthy, it must be true. If their doctor told them to avoid butter, margarine must be better. There was no reason to suspect otherwise. The system was supposed to protect them. And so, over the course of 10 years, the American diet shifted. Breakfast cereals became a staple, marketed as wholesome and energizing. Snack foods were reformulated and sold as guilt-free. Bread consumption increased. Pasta was encouraged. The food pyramid introduced in 1992 placed grains at the base, recommending 6 to 11 servings per day. Fat was pushed to the top, to be eaten sparingly. Children born in the 1980s grew up in this environment. They didn't know that the food their parents ate as children had been different. To them, this was just food. Low-fat crackers in lunchboxes, juice boxes instead of water, snack packs designed for convenience. It was normal, routine, unquestioned. But the real impact appeared years later. By the mid-1990s, obesity rates in the United States had begun to climb sharply. Not slowly, not in isolated communities, everywhere. Between 1980 and 2000, the percentage of obese adults nearly doubled. Childhood obesity, which had been relatively rare, became common. Type 2 diabetes, once called adult-onset diabetes, started appearing in teenagers. The medical system had expected these guidelines to reduce chronic disease. Instead, the opposite was happening. By the time the consequences were visible, the habits were already set. An entire generation had been raised on the low-fat model. Their taste preferences had been shaped by it. The food industry had invested billions in reformulating products to meet it. Reversing course would mean admitting the guidelines had been wrong. It would mean confronting the institutions that had endorsed them. It would mean questioning a framework that had become embedded in policy, education, and commerce. So instead, the explanation shifted. People were told they weren't following the guidelines correctly. They were eating too much. They weren't exercising enough. The problem wasn't the advice, the problem was compliance. Responsibility was placed on individuals. Parents were blamed for their children's weight. Adults were told they lacked willpower. The system that had designed the experiment remained beyond scrutiny. But there was a deeper issue, one that took longer to recognize. The guidelines hadn't just changed what people ate, they had changed how they thought about food. Fat became the enemy, even though humans had evolved eating it. Hunger became something to suppress rather than a signal to pay attention to. Eating was no longer intuitive. It required labels, portion control, and constant vigilance. Food had become a source of anxiety, not nourishment. This wasn't an accident, it was structural. The food industry operates at scale. Its goal is not to nourish individual bodies, but to produce products that can be manufactured efficiently, shipped long distances, stored indefinitely, and sold at a profit. When the government issued guidelines that demonized fat, the industry responded by creating foods that fit the new criteria. These foods were cheaper to produce, more shelf-stable, and easier to market. They also happened to be less satiating, which meant people consumed more of them. The guidelines had created a market. And once that market existed, it defended itself. Food companies funded research that supported their products. Trade groups lobbied to keep the guidelines in place. When independent scientists began questioning the link between dietary fat and heart disease, they were marginalized. The American Heart Association, which had been instrumental in promoting the low-fat message, received millions in donations from vegetable oil manufacturers. The revolving door between industry and regulatory agencies meant that the people writing the guidelines often had financial ties to the companies that benefited from them. This wasn't a conspiracy. It was how the system functioned. The same pattern played out in schools. The National School Lunch Program, which feeds millions of children daily, followed USDA guidelines. That meant low milk. That meant more bread, more pasta, more processed grains. It also meant contracts with large food suppliers who could meet federal requirements at scale. Smaller producers, who might have offered fresh, minimally processed options, couldn't compete. The result was a generation of children who ate industrially produced food every day in an environment where they were told it was good for them. By the early 2000s, some researchers had begun to publish findings that contradicted the original hypothesis. Studies from Europe showed that populations with high saturated fat intake didn't have higher rates of heart disease. Trials that replaced saturated fat with vegetable oils found no reduction in mortality. In some cases, outcomes were worse. The evidence was mounting. The guidelines might have been based on incomplete science. But changing them wasn't simple. Admitting error would mean confronting decades of policy. It would mean acknowledging that millions of people had been given incorrect advice. It would mean rewriting textbooks, retraining healthcare professionals, and restructuring food assistance programs. It would mean economic disruption for an industry built around low-fat products. So instead, the guidelines were revised slowly, cautiously, with language that avoided direct contradiction. Fat was no longer bad. It was nuanced. Some fats were acceptable, others remained discouraged. The food pyramid was replaced with a plate diagram, which was easier to understand but still emphasized grains. The core message stayed intact. Carbohydrates were safe. Fat was risky. The experiment continued. Meanwhile, the effects accumulated. Metabolic diseases continued to rise. The healthcare system strained under the weight of managing chronic conditions that, in many cases, were linked to diet. Research into the gut microbiome, insulin resistance, and inflammation began revealing that the body's relationship with food was far more complex than a simple fat equals cholesterol model. But this research took time, and while it was being conducted, people kept eating the way they had been told to eat. The longest food experiment in history wasn't happening in a lab. It was happening in homes, schools, and hospitals. It didn't have a control group. It didn't have informed consent. It just had compliance. And the people who complied believed they were doing the right thing. They bought the low-fat yogurt. They avoided egg yolks. They counted calories and felt guilty when they ate butter. They taught their children that fat was bad. They watched themselves gain weight and assumed it was their fault. They didn't know they were part of an experiment. They thought they were following medical advice. That's what made it effective. A true experiment requires uncertainty. It requires the possibility of failure. But the dietary guidelines were never framed as uncertain. They were framed as fact. And once something is presented as fact, questioning it becomes difficult. To question the guidelines was to question your doctor, your government, your child's school. It was to stand outside the consensus. Most people don't do that. Most people trust the system, especially when the system insists it's trying to help. But some did begin to notice. Parents saw their children struggle with weight in ways they hadn't as kids. Athletes found they performed better when they ate differently than recommended. People who ignored the guidelines and ate traditional diets, rich in animal fats, low in processed grains, reported feeling better. These observations were anecdotal. They weren't published in journals, but they were real. And slowly, the conversation began to shift. Not because the institutions admitted fault, but because the evidence became impossible to ignore. The obesity crisis hadn't reversed. Diabetes rates hadn't fallen. Heart disease remained the leading cause of death. The promised outcomes hadn't materialized. At some point, the gap between prediction and reality became too wide to explain away. Similar decisions followed. The approach that had been used for fat, identify a villain, issue guidelines, reshape the food supply, was applied to other nutrients. Salt was targeted. Cholesterol was limited. Sugar, for years, was exempt from scrutiny, partly because the industry funded research deflecting blame towards fat. Each time, the same structure repeated: expert recommendations, government endorsement, industry reformulation, public compliance. Each time, the outcomes were mixed. And each time when the results didn't match expectations, individuals were held responsible. Not the guidelines, not the institutions, not the corporations. The people who had trusted the system were told they had failed it.